So let's start with the case today, and we'll see what we have. So I will get through very quickly about the general case, and then after that I will ask you guys some question, okay? Based on what you check from the medic from your SB, I mean your patient. All right. Yeah. Thank you. You're welcome. Okay, so that's for the patient profile and about the kind of the symptom. Here are clinical symptoms. So we have that's a 29 years old male with a 15 days of fever and headache. 1 day ago, he started to be hemiparesis. So before we start this Casetalk today, we also send you guys about the vocabulary, right? So have you differentiate between like hemiparesis with another word is what is hemiplasia, right? Yes, and like this is different about this. One this is positive and another this is weakness. So this is for the hemiparesis. I mean like this is paralytic. I mean yeah, and for the this is hemiplasia, just like this is weak. The symptoms is this is not serious like hemiparesis. We have last few days he has been increasing somnolence and confusion. It's mean like disoriented. And previous medical history was non-significant. He had a dental procedure 2 weeks ago. I mean before the symptoms started. So the dental procedure is also the part you need to pay attention on that, right? So he have fever. Yeah. So the past medical history, no significant. Like she had the surgery of the dental procedure 2 weeks ago. Medication no, allergy no, no hospitalization no too. Family history nothing significant. So we don't have anything to can find from here. Oops. All right. About social history, smoking for 10 years, 1 pack per day. Alcoholic social drinker. We can only 1 to 2 cups. Caffeine no. Deny using any drugs. And singles mean like he's still like didn't married yet. I don't know what happened. Okay, for review system, you can see here the patient fever, the positive symptom here: fever, headache, confusion, somnolence, dry, hemiparesis. They didn't mention like this where exactly, right? The hemiparesis is one over like half of the body. Physical exam: BB normal, respiration rate normal, heart rate normal, temperature is high, it's mean like fever, oxygen saturation is normal too. For physical examination, everything here what abnormal, you guys? Bye. Yeah. So we have like the general so ill appearing. The ill appearing can sometimes like from like patient feel tired. That can be from like the infection, like make the patient weak. Sometimes we say like infectious face, infectious appearance. And we have like heart is a hollow systolic murmur at the apex. That's the positive, right? Here, the lungs normal. This is neural. They have the oriented time, person, space, but patient know about his age, but not aware the date and the years. So that means like disoriented and kind of because of somnolence and confusion. Right, homonymous hemianopia. I will explain about what is that. Facial palsy on the right side. Another thing, spare the forehead. All right, in here, can I say the facial palsy on the right side and the spare the forehead? Can you make diagnosis? What problem here? I mean about the symptoms, based on the symptom. What a problem of the patient now?
I think it is chocolate bell.
Okay.
Maybe.
Bell. That's
bell.
Bell palsy. Any idea? Any another idea?
I think it's the peripheral facial palsy.
Peripheral facial palsy. Any another idea? Interesting. Oh my god.
How about the central paralysis of the cranial nerve 7?
Yeah, that's central, you guys, not peripheral. So I will explain about this. That's central, ponsive. Central CNS 7 ponsive, cranial nerve, and where the location is in the right side. Okay. So if it's on the right side, where is the injury?
The left. I think the left.
Where the forehead. Who sent to me like about where's it? So that's it. Where Ying, right? So you say like this is spare the forehead. You think that's a loss of the kind of some wrinkles in the forehead, right? So you
write in the vocabulary that spare the forehead is magnet nhang trán.
In here has spare the forehead. That's the maybe that's about a mistake in the vocabulary. I think that's our mistake. That's the spare the forehead mean like they affect another place, but the forehead is still intact. So spare the forehead mean like that still let's keep that. It's not have effect on the forehead. So that's the magnifico ponsive on the right side. It is a central. I will explain about this in next slide. Everything is normal, and for that's the minutes about the muscle turn on the right. Yeah, the patient have the problem with the right side. The reflex 1 to 4 on the left and 2 to 4 on the right and 2 to 4 on the left. 1 to 4 means 1 for hand, 4 for leg. 2 for hand, this is a 4 for leg. So that's it. Mean that's a degrees of reflex in the leg. I mean this is lower extremities, both sides, left and right. Baby ski side on the right. See the problem in the right too. Diminishes the pain and temperature of the right side. So now the right side show a lot of problem. No meningitis. No. So that's help us to can eliminate the meningitis. No aphasia mean like does not affect another CNS. Especially it is about the function of the motor function. Alright, so anyone ask about the lab test? What the lab test can help us can help me list the lab test you want to know about the patient, and I will show you guys one by one.
I would like to ask about.
You want to ask about CBC? Okay, another. Okay, show me more, and I will like see scan of the head. Okay, what else? What do you want to do? CSF. Okay, interesting. CSF mean like MRA, right? Okay, echocardiogram. Why fact go with ANA? That's interesting. That's it for lupus.
Yeah, I am thinking about a lupus disease.
Oh, really? Okay, keep that. Blood culture. That's also a good point. CT, MRI, CBC, CSF, electrolyte. Okay, that's not necessary here. Electrocardiogram. Yes, also good. Wow. So let me show one by one. You guys will see like we're doing it about this. I hate that. All right. So about we do how about the I will go with the MRI test first. So they do the imaging test. Have you take a look at the imaging test? Yeah. Yes. So the MRI, the brain MRI restricted diffusion, inferior brain lesions like left occipital, bilateral cerebellar hemisphere, basal nuclei on the left side, internal capsule on the left, bilateral frontal regions. Echo reveals vegetative, it means like echocardiogram, review vegetative lesion 14 mm in the mitral valve causing mitral insufficiency. So till now, can you guess about what happened for the case?
Can you explain about the mitral insufficiency is the mitral regurgitation, right?
Sorry, you want me explain why like we have
No, I just asked mitral insufficiency mean that mitral regurgitation.
regurgitation. Yes.
Yes.
Sometimes like have some another materials they use like insufficiency, and sometimes make us think like that's a lack of the function and about the structure, and like make this is not full enough. Yeah, this is not enough. Not full enough. The function and the structure can make the valve work effectively. So kind of they say like that, but have some materials like they mean like that's the same meaning like about the insufficiency and regurgitation. They use for that sometimes like the same meaning because for insufficiency they sometimes they mention about the stenosis, but they never use about the stenosis, mitral valve stenosis. That's a definition. So for according to my knowledge, and I saw like that's the insufficiency that's usually used with the regurgitation. So problem with the heart, problem with the brain, and that's the culture for the blood culture. So we do another lab test. They want to do HIV test. You guys missed that. So I will explain why they want to do the HIV test. Okay. And they also do the blood culture to see positive for Staphylococcus aureus. So till now, can you guess more about the diagnosis here? So what problem? Can you
Yeah. I think it's subacute endocarditis.
Subacute?
Maybe, I'm not sure, I didn't remember exactly, but the patient had a history of dental procedure and about a half a month before, and now he have can I see the echocardiogram?
Okay, here.
We have a vegetative lesion in the mitral valve that has mitral insufficiency, and maybe the blood clot are have in here, and they go to the brain, making some neurological problem. We are shown here. I think you see the problem with the patient.
Yeah. So you guys can have another idea or want to make the diagnosis already. Yeah, that's the any problem with the valve of the heart, especially here this patient have the endocarditis. Go with yes, that's the blood culture. Like what somebody asked me to show you about history. Yeah, the history of the patient like that. So fever and headache, and like about swollen hemiparesis confusion, and no significant history beside the dental procedure 2 weeks ago. Alright, so yes, we don't have all of the lab tests because like that's a real case. To be honest, you guys, that's a real case, and that's the case Mitral tech from in the US, right? So like in his hospital, that's a real case. So but that's really interesting, and that's a very emergency problem, and we need to do something for half the patient. So until now, you guys tell me like patient have the endocarditis, right? So what problem next can make the symptom for the patient, and can you make more clear about the diagnosis here?
I think it might be sepsis.
Sorry, again?
A sepsis, like an inflammation. When
septic.
Yes.
Septic.
Yes.
Sepsis. Okay.
That might lead to a septic shock, and the patient can be
septic shock. All right. So the shock can make with the brain. The sepsis can make problem with the brain, you guys. All right. So let's start with the from the beginning. The patient go with the procedure, like a dental procedure, and they have about fever, and they have about headache, right? So what make the fever now? It's mean like the patient, and then we see the problem with the valve, the mitral valve. So it's mean like from the procedure have like bacterial can go from that blood to the heart, especially here. That's a mitral valve, right? And that's make heart can make mitral valve here. It means like patient have the endocarditis. So that's affect the valve, make the mitral valve regurgitation. If I write something wrong, fix me because I'm not good in writing. Especially like I can read that, but I don't remember exactly the full name. All right, so regurgitation. Yeah, somebody text me. No. Regurgitation. Yes, it's here. Mitral valve regurgitation. So endocarditis, and you guys say like the patient have the dental procedure, and you say that's a subacute, but actually for staphylococcus aureus, and it's be like patient have here this staphylococcus aureus. It means like that's not subacute. It means like acute or subacute. Acute. Okay, that's acute endocarditis. And that's a mitral valve regurgitation because it affect the valve, especially most common for the mitral valve. And then what happened in here? Make brain injury. Still, you guys still cannot feel that from the mitral valve regurgitation. What they make here? That's the blank. Think about something like make brain injury.
As embolism.
Embolism, yes, correct. Embolism. Yeah. What else can make here?
Vasculitis. It might be vasculitis.
Vasculitis can make kind of and because of embolism, not much, but it's also affected vascular. Yes, that can affect vascular. Oops, sorry guys. Oh my god, I cannot open that again. All right, so this embolism, and that can make go. That's the stroke. And we call like that's the ischemic stroke because of embolism, and this can go to the brain. I cannot know why that's I cannot move too much. And what can make so I want to show you guys more about. So we have about like in here the brain in the MRI, they say there's a restricted diffusion inferior brain lesion in some place occipital that make a bilateral cerebellar hemisphere, basal nuclear internal capsule, and bilateral frontal regions. So when you look in like that, you will think about kind of symptom for the patient now, right? Because that affect the brain and the specific place. So when they go with the occipital, what they can affect, especially they will affect to the visual function. When they go to bilateral cerebellar hemisphere, so kind of they means they with patient you want to looking for about the symptom for ataxia, for coordination. That's a main function for the cerebellar. They go with the like basal nuclear internal capsule, like can make about the sensation, the paresthesia, the sensation, degree sensation, especially in here's a pain and touch sensation. It means like superficial sensation. And kind of frontal region, maybe the patient have the behavior change, but the luckily thing patient in here don't have that. Alright, so that can help you explain about the symptom for the patient more. So some the medical thing, some clinical pearls you can have find based on that. Actually have like about restricted diffusion, like infarction, like abscess, kind of like make you can see the MRI. That's the imaging for multifocal infarction. Sometimes they go with stroke, can come from the heart or the blood. If you think about meningitis, actually this case I don't think that patient have meningitis. Patient have the encephalitis because they have like CNS symptoms, and they also have about the neurological deficit, right? So it's not like meningitis. Meningitis, they can have like nausea, vomiting, right? Kind of more than, and especially hydrocephalus, or even like related to the visual increase of the intra-occipital pressure. So it's not seen in this patient. But in case you think patient have meningitis, you should treat the patient before you make the diagnosis. Treat the patient immediately and do the isolation with the patient, because it can affect like transmitted to you based on the air or different droplets, airborne droplets. But it's not case for this patient. All right, so what we learn from the case, we go with the endocarditis. That's the form. I take the material from FA book. That's an endocarditis, and it will have the bacterial and non-bacterial. But we go with the bacterial first, because non-bacterial we go with something like fungal or another disease like lupus, like Fat want to looking for. But it's not for this case. This is very clear. This is bacterial. You guys, that's a bacterial that make patient have the fever, have kind of symptom from like the procedure of the dental procedure. So like this case we're looking for, that's the Staphylococcus aureus. So that's usually acute. And why the case, why like they want to do HIV test for this case? Who can help me to explain that?
I think in the patient who have HIV, they usually use the drugs, intravenous drugs.
Yes.
And intravenous drug is the high risk for the infection of the Staphylococcus aureus.
Yes, correct. That's the they want to make sure the patient has HIV or not, because they go with the IV drugs, and IV drug can make like endocarditis. That's the acute with the Staphylococcus aureus. That's the most common cause. And all right, so when they go with the acute, we have last vegetation, and that's usually affect to the healthy valves. Healthy valves, not like the damaged valve or prosthetic valve, you know. So that's very very acute and high virulence and rapid onset, and the patient can easily get fatal if you untreated. Okay, fatal is mean death. We can have another cause like sepaki with another bacteria and some another symptom. You guys can take a look at this about some like another symptom here about related to the valve and the extra valve, mean like the raw spot is mean a problem with the ear, the vessel in the retinal vessel in the eyes, and also with the retinal ocular node kind of here, or even like Janeway lesion or splinter hemorrhage. You can see off the side here. We sometimes call like chain. They have the sub like abbreviation or like mnemonic. Can help you to remember about this endocarditis. And we also have a lot of causes here. You guys can take a look at this. And we also divide like bacterial and non-bacterial. So that patient here go with the dental procedure and make infectious for the make this effect from like staphylococcus that get through from the blood vessel and go to the mitral valve, go to the heart, and that's affect to the endocarditis, make endocarditis, and here's the acute endocarditis. And most common cause for the staphylococcus can have effect in the valve. This is a mitral valve, can easily get damaged. And at the beginning or early stage, they can go with the regurgitation, but for the long term, they can make like okay. So let's go with in here we have, I don't know, I cannot see where's the aneurysm, myocardial aneurysm. I cannot see it. So on the echocardiogram, I forgot to show you guys. I don't know where the content, but like in this patient, we find that we found this a patient have the myocardial aneurysm. So in the vocabulary, you can see that. So the myocardial aneurysm, what type of the aneurysm based on, usually based on the bacterial. And sometimes they say that the myocardial is mean like fungal, right? And sometimes we get the misunderstand that is maybe that's from the fungal infection. But actually the myocardial, it means like the shape of the vessel. So if you see here that the shape is look like the mushroom. and that's a mycotic aneurysm. It's mean like the mushroom aneurysm, a shaft, and that's the cause is usually from the bacterial, so that's a username for that. And they also have kind of another type, the aneurysm from like saccular. It's mean like the sac. The sac mean like the seat, or even like the atherosclerotic aneurysm. We like have lots of the atherosclerotic plaque here. Or traumatic aneurysm, mean like have the damage to the vessel. We can see that's from like about the problem to the valve. What you see from here, and you can learn from the new words.
Is it the regurgitation?
No, more than this. That's more so big, and that's so very like you can see that this look like this that can show the injury in there. So more than this, can you help me another words? Give me another words.
I think this is a vegetative lesion.
Sorry again.
Vegetative lesion.
Yeah, vegetative lesion. Correct. Can anyone help me to write down on the task box, and can have everyone here can know that. And the vegetative lesion is mean like damage to the valve, and that's make the valve cannot be smooth and look beautiful like normal, and it's become like a little bit not stenotic, but it's damaged, and this show like it's look like cauliflower. Kind of like that. I cannot use the name cauliflower. Look like it's like it's not smooth. It's not like beautiful like normal. So the valve get damaged. Yeah, thank you, Vâng. Okay, so we learned with this case like patient have like vasoconstriction from the CNF7 and like cranial nerve 7. And in here, I can help you guys to understand between like what is the peripheral and this central, right? So you can see here, I think like a lot of people get confused from that, right? That's make you guys feel like neurology is a very, very, that's a very like hard and difficult to understand. So they divide into type of the lesion, like upper motor neuron. Yeah, in here it's mean like upper motor neuron. You see here, this is a lower motor neuron. Okay, so that's it. We have in this brain cortex, and they have like the signal. I mean like the CNS signal, and you can see about the line, the color of the line. We have like blue line, and this is a red line. When you look at that, we have that. I can give with this right. All right, this is the left. I mean that's the right based on my hand. So that's the left side, that's the right side. So can you guys tell me what is to keep consistent? I mean like where the side in this case, I mean this picture still go with the one way, and they cannot affect with the injury. If I have like the lesion in here, I go with the with that place I have problem in here. So you can see the facial nerve and nucleus, they receive two signal. One signal from the right side, right? One the line here from the right side, and can go with the lower part of the face. And they also receive another signal from like the left side. They go with the lower division, and this upper division. So this is for the upper facial nerve. They stay here, and they get with the one side to the upper facial part, and the left side they go with the lower division, and they go with the lower part of the facial division, right? So when we get damage in here, what still keep and what is lost? Upper division has received two signals from like the left side and the right side. The lower just receive from the one side to the left side. So when we get damage in the place, what the problem?